Thanks so much for joining us. Can you give us an update on Magic Valley's hospital capacity right now?
Yeah, I guess to give a little context, we've been very strained over the last several weeks. It's been near capacity volumes of patients, increasing numbers of COVID patients. So, it's been a very trying time for our staff. We've been having to send some patients up to Boise when we haven't had room. So as of today, things are not necessarily looking brighter, but things are stable. We're back open to some admissions, not necessarily from the outside, but we're not on diversion. So we're handling the capacity that we have right now, and the COVID volumes are down just a little bit, but I think it's within a sort of a spectrum of what we're expecting over the next still couple weeks.
And you talked about how you're not currently diverting all patients, but you have been diverting a few patients over the past week.
Yeah, out of necessity, we just haven't had staff, and we've had to have patients that appeared in our ER that we could not bring into the hospital at Magic Valley and have send them to Boise because of just our inability to have enough staff and beds to take care of them.
Tell me about pediatric admissions.
Yeah, just this morning, we're announcing that we're not able to keep pediatric admissions at Magic Valley Hospital, which we normally have done. We have a pediatric hospitalist team that takes care of peds patients, but just to conserve both space and staff, we're not going to take any new pediatric admissions for the next little while, have all of those go up to the pediatric hospital. So that's a pretty big change for how we normally operate.
So you've been sending some patients to Boise. If you fill up and have to send even more to Boise, and if Boise fills up, what's the contingency plan there?
Yeah, I mean, we've got partnerships for hospitals that we normally send patients to. It kind of gets down to this issue of starting to make calls and understand what surrounding health systems, hospitals, even neighboring states, what their capacity is, and then finding a place to send people. It's a really suboptimal position to be in. And it's frankly the thing that we've been talking about trying to avoid throughout the pandemic. So the fact that we're sort of toying with the possibility of needing to do that is very sad.
Tell me about how this is affecting staff. Are you short on staff, and how are you handling it, if so?
Yeah, I mean, that's probably the X factor in all of this is as the community spread of the virus gets sort of out of control, you inevitably lose a lot of employees to illness. And so we've been good about protecting our staff from COVID in the hospital. But of course, they go home to families, they go home to their children. And we've had a lot of staff out with COVID. So yeah, for the last couple of weeks, we've been going into many nursing shifts between 4 and 15 nurses short. And that requires just constant effort by the administrative nursing staff to be calling and bringing people in for extra shifts, work, overtime. It's been exhausting for everybody. I mean, the nursing staff is working extra shifts and overtime. The physicians are seeing more patients and working more shifts than normal to meet the need. And, that takes its toll. You can do it for a while. And I would say that spirits actually have been okay in the hospital. But I mean, I just don't know how long you can sustain that before people start really losing it.
So hospitalizations, of course, are a lagging factor. And I've been keeping an eye on cases in Magic Valley, and they're not going down. So what's going to happen in 2 weeks, and how are you preparing?
Well, I mean, to answer that question, we really need to go back to what we've been doing over the last 6 months. I mean, we've created very detailed plans internally for, a lot of different contingencies. I mean, just, short term, we're looking at standing back up our incident command, so we have basically people working on COVID and COVID placement 24/7. and again, just being in close communication within the health system, we have started meeting with our central incident command to look at staffing. I know that the health system, administration, our COOs and that level of the administration is constantly just thinking about staffing. We've got requisitions out for travelers. It's just a constant push to make sure that we're meeting the need. And then, we move into the next layer of contingency where, as we talked about earlier, like where do we send our patients next if all the hospitals are full? Now, right now, the Boise hospitals, especially per capita, kind of have less COVID patients than Magic Valley does, but they've been full just from general patient volumes. And so then you move into, Boise having to look at shutting down some of the elective cases and saving hospital beds. And, you begin some of the things that we did in the early phases of the pandemic as we were preparing.
When you're looking at worst case scenario, is there a contingency plan that involves rationing COVID care?
Yeah, absolutely. I mean, the very worst case scenario, you get into what are called the crisis standards of care, which I'm not heavily involved with the detailing of that plan, but it's essentially where you're having to ration care. And, we've never in America really honestly faced a situation where we've had to do that systematically, where we've had to say, no, we can't treat you. You're too old. You're too sick or anything like that. And so that, I think, is the sort of most appalling idea that we could even be talking about that being on the table. And that is part of our end game contingency planning.
How close are we to that end game?
I think we're still pretty far off from that end game. I mean, there's still levers that we can pull, adjusting nursing ratios, which again does lead to the possibility of having bad outcomes just because we don't have enough staff to care for the patients at the level we would normally want to. But again, I think we would probably push pretty hard on that before we were saying, no, we just can't even treat you. We're going to just let you die here in the hallway or something.
We've talked about levers that the hospital can pull, but let's talk about levers that society as a whole can pull. We've heard officials say that voluntary mask use is high, but people on the ground are saying that's just not the case, not just in Magic Valley, but throughout the state, especially in communities without mandates. What's your experience?
My experience is that masking is not high, but it really does seem to depend on where you're going. I personally try to avoid places where they aren't good about doing masking. So, I mean, just in Twin Falls, we have, shopping centers that really do enforce masking and people are wearing masking. And then you go to one just, half a block away and they are not. I mean, it's just almost nobody's wearing masking. And so I think it's very variable depending on what location you are and where you are. I would not say that there is widespread elective masking right now.
So do you think a mandate would help?
Well, I think, again, the arguments around whether you can mandate something that's difficult to enforce, like masking, are pretty hollow to me. We have a lot of rules and laws which are intended for public safety, which really widely are followed without a lot of aggressive enforcement. I've never been pulled over. Well, I don't text and drive, but I'm trying to use the example of texting and driving. A lot of people don't text and drive because they know it's the rule, right? And so whether I know if police have ticketed anyone in Idaho, I don't know for sure, but just making a rule does tend to encourage people to more sort of aggressively follow that rule. Speed limits are the same. There's not a cop on every corner making sure that people are following the speed limit, but in general, people tend to follow speed limits, at least broadly.
You have a statewide audience right now. What's one thing you would like public policymakers to know?
We need to do more. I mean, from a public policy standpoint, we're really not doing anything systematically to try to combat the virus. experienced this week has been that no legislators at any level are really willing to do anything to help stem this tide. And they're really asking frontline healthcare workers and frankly the schools to shoulder the entire burden of the virus right now. And so again, do something to help your community be more safe. This is resulting in deaths of people, and some of those are almost certainly preventable. So let's do something about that.
I wanted to ask you about this week's Public Health District 5 Board of Health meeting, at which some of the commissioners really expressed intense skepticism that a mandate would work. And in fact, a couple of them voted in favor of asking the governor to implement a statewide mandate, but voted against implementing one themselves. So where does the buck stop when it comes to these policymakers?
Yeah, I mean, it's a little bit what we've seen at different points during this pandemic is really because of the other political pressures, people being concerned about freedom and the concerns that we could go back to needing to shut down businesses. I think they sort of bow to that pressure and don't want to take any actions, even one like a mask mandate, which of course does not shut down businesses, and I would argue keeps businesses open, which I can expand on in a second. But yeah, to me, it doesn't make sense if you're asking the governor to do a statewide mandate, but you're not willing to vote for a local masking mandate. It really is about not wanting to be the one that made the decision. And so that's what we've seen at almost any level within this pandemic. The federal government has said states should deal with it. The states in large part have said local should deal with it. Local says even more local, the city should deal with it. And then, or they send it back up to the governor to try to deal with it.
Let's talk a little bit about that, because balanced with public health, you also have the health of the economy. And while Idaho has had some of the strongest economic rebound numbers, depending on which metric you look at, there's still a really big concern about the mental health effects of a shutdown. So really, how do you balance the concern over the economic health and the mental health of people and the public health aspect of mask wearing?
I think it's a little bit of a false dichotomy, because the reality is we're getting shutdowns as a result of the virus. So I'll share just a personal story from this week. One of my office mates went to the coffee shop to pick up pastries and coffee for the team because we've been working hard this week. And the coffee shop was closed because of COVID, right? So, and I know that they were not wearing masks in there the week before. So this is exactly why that's such a false dichotomy, because the reality is, would masks for sure have kept them open? I can't say that, because they may have gotten the virus at home or whatever, but it certainly is suspicious that a store that was not masking is now completely closed, doors locked, because their office is out sick with COVID. And we heard, on the press conference with South Central yesterday from Cliff Bar saying they're having trouble keeping, all of their shifts running. And he actually shared economic numbers of what the impact of people being out sick this year has been, not shutdowns, but just out sick. And it was like $200,000 that it's cost them because of lost revenue by people being out sick. So I see this as completely a false dichotomy, and wearing masks actually probably defends the economy better than anything else. Part of the reason I would say that our economy has been so strong is we've kind of lucked out and we haven't had the big outbreak like we're having in Magic Valley.
All right, Dr. Kern, thank you so much for your time.
Yep. Thank you very much. See you.